अस्सलाम वालेकुम इय्याका नअब्दु व इय्याका नस्तईन। वेलकम टू माय चैनल डॉक्टर शामी सेज। तो आज से मैं सर्जरी के SK17 सीरीज़ के पेपर स्टार्ट करने जा रहा हूँ। सो लेट्स स्टार्ट विद सर्जरी 21 नवंबर आफ्टरनून पेपर। क्वेश्चन नंबर 1, रेस्पिरेटरी एसिडोसिस occurs in drowning. The serology test for the aspergillus is galactoman. Posterior and the anterior humeral artery are the branches of the axillary artery. The patient having vesicles in the lateral forehead and the medial side of the eye and L of nose with severe facial pain and the headache. Which nerve is involved? The maxillary vein of trigeminal nerve. The patient undergoing thyroidectomy develops harshness of eyes. Nerve involved in the vicinity of inferior thyroid artery ligation is the recurrent laryngeal nerve. Question number 6 P same है. Question number 7, young man sustained artery with a multiply fracture has difficulty in breathing. You notice that his chest is moving board in breathing. Which muscle help in the breathing? That is external oblique. Question number 8, hand, foot and the mouth disease causing virus is the non-enveloped RNA virus. Question number 9, intercostal nerves are from the dorsal MI of the spinal nerves. Question number 10, the nerve passing through the petrous part of the temporal bone is the facial nerve. Question number 11, alcoholic person develops hepatic cirrhosis, diuretic of the choice to leave the edema and the ascites at the spinal electron, the spinal cord compression due to osteophytes, the posterior interosseous nerve supply which muscles, that is the anconeus. The patient had asked to grip the cord between the tip of the index finger and the thumb. Which nerve injury is checked in this test? That is anterior interosseous. Question number 15, the smoker who is having 2 packs per day with associated heart disease is at the risk of which arterial complication? That is the atherosclerosis. Man with the hearing problem and was tested, he cannot recognize the source from which sound is coming due to the defect in the lateral superior olivary nucleus. Next, question number 17, most common intracranial tumor is the astrocytoma. The 60-year-old man presenting in OPD with a complaint of hematuria and increased urinary frequency on DRE. There is a stony hard mass felt, that is prostate. Lymphatic drainage of it would be the internal iliac and external iliac. After gunshot injury to lower back, the patient has loss of the contralateral pain sensation by the intact temperature sensation. Likely diagnosis, the section of the dorsal root S1. The phrenic nerve avulsion at its origin will lead to the hemidiaphragm paralysis. 21, as compared to the plasma, CSF has the decreased protein. Question number 22, left shift of the oxygen dissociation curve is caused by the hypothermia. Question number 23, the extreme left shift of hemoglobin oxygen curve is due to the which of the following? That is carbon monoxide poisoning. Question number 24, the student has the viva exam. What waves are seen in the EEG? That is the beta EEG of the patient shows no A wave because the patient is alert and conscious. Next, question number 36, antiseptic used for the skin wash is the alcoholic chlorhexidine. 27, the aortic pressure is highest at which phase of the cardiac cycle? The rapid ejection phase. 28, the nerve loop around arch of aorta and the ligamentum arteriosum is the left recurrent laryngeal nerve. The hyoid bone is derived from the second and third pharyngeal arch. Lady had the difficult labor at the home in the village. She was brought to hospital. The history of the PV bleed oozing from the gums for the last 10 hours. Her CBC shows 6 grams/deciliter. The platelets 30,000 TLC, 24,000 with the neutrophilia. The peripheral blood film shows blood cells. Her PT and the APTT were prolonged. Most likely cause is DIC. Next, 31, the functional remnant of the mesonephric duct in the male is the ductus deferens. In 32, in abdominal, the gynecological surgeries, which are the following organism causing infection, which are penicillin resistant, and the beta lactamase production are the bacterioids. 33, the patient having the proteinurias and the hematuria. The cause of generalized body swelling would be the decreased plasma oncotic pressure. 34, the patient presented with the fever, productive cough, and the altered sensorium. X-ray shows the lobar pneumonia. How to confirm the diagnosis? The sputum culture. M-band is in the multiple myeloma produced by which cells? That is the plasma cells. The patient has CV and now has zero power in the muscles. Which of the following sensory receptors are not functioning in this patient? That is the nociceptors. Next, 37, an 18-year-old male is brought to the hospital in altered sensorium. He is taking slow shallow breaths and his breath has a fruity smell. That is definitely DK. pH is less to 6.4. 38, the NK cells cause falling destroy virus infected cells. In COPD, diagnosis will be made by the VQ ratio equals to 0.1, which is the following cause increase in the renal level, that is the decrease stretch on the mechanoreceptor. Which one of the following increase in the asthma eosinophil? Which is the following increase in the asthma eosinophil? Substance having the most properties than inulin is thought to have the increased filtration rate and net secretion. A woman presented with the high grade fever, the chills and cola urine examination, splenomegaly, and the stool test revealed crescent shape gametocyte in the blood. Cause would be the the plasma falciparum. The patient is having rhinosinusitis and the nasal polyp with the fungus invading lamina papyracea, excessive endothelial damage, and the having non-septate hyphae. Organism involved is the mucor. The tumor suppression gene involved in the renal and the gonadal agenesis is WT1. ICF differs from the ECF in the increased potassium. ICF as compared to the ECF has the increase in the glucose. Next, 49, the accessory meningeal artery passes through the foramen of veil. The meningitis due to the staph pneumonia in 14 years old child. Drug of choice will be the penicillin G. Most common cause of the bacterial conjunctivitis is the staph aureus. Patient has the low limb paralysis and unable to recognize objects with the damage of ACA. Latter part of the foot damage during the drill exercise of arming cadet in the PMA lymphatic drainage of it is the probability which of the following is present. The posterior most opening of the diaphragm, that is the aorta, thoracic duct, and the azygous veins. Next, 55, aortic opening passes through which vertebral level on the diaphragm, that is the T12. After strangulated femoral hernia, repair which one at the risk of the damage, that is the femoral vein. Sesamoid bone is patella. A boy continuously failing in the exam, he is doing anger to his parents. This type of the defense response is displacement. Large tumor in the posterior mediastinum will compress descending thoracic aorta. Next, question number 60, what is the inheritance pattern of the hemophilia A, that is X-linked recessive. 6-year-old boy with the swollen tender knee, history of excessive bleeding after tooth extraction. What is the best test for the diagnosis cause of the bleeding, that is the factor A minor SS. A 9-month-old baby fell from the bed and got frontal ecchymosis. His HB is 5 platelets, 1,80,000. Two sisters are normal, but the brother died of profuse bleeding after circumcision. Which is the most appropriate test to rule out the other cause, that is the coagulation profile. Next, which of the following structure lies deep to in the parallel with the carotid sheet, that is Charlie sympathetic chain. After mastectomy for the breast carcinoma, female develop loss of the overhead abduction, which is due to the damage of the nerve to the serratus anterior. Next, 65, a lady working the radiation zone, which is the following system affected first by the radiation, that is the hematopoietic. Which vein is used in the venesection? There is a great saphenous vein. Which vein is used in the venesection? Great saphenous vein again. Next, female with the oligomneria karyotype 46XX45X nullo associated features would be the gonadal dysgenesis and the germinal hypoplasia. Next, question number 69, the medial to thyroid gland is which of the following? The recurrent laryngeal nerve after chemotherapy. Tumor size regressed by the apoptosis after chemotherapy, regressed by the apoptosis. The peripheral vasodilation along with the hypotension seen in the septic shock. A cell was on the microscopic examination. Large micronuclear densities are found indicating irreversible cell injury. The muscle involved in the unlocking of the knee joint is the popliteus. The study was done to determine the importance of smoking as a risk factor for developing lung cancer. 500 smokers with the disease and the 500 healthy matched non-smokers were evaluated. The type of study would be the cross-sectional study. Most common pancreatic carcinoma is the adenoma. Patient has the weakness in the flexion, supination, the sensory loss on the lateral side. Which of the following nerve injury is responsible for this? That is the musculocutaneous nerve. Gram-negative bacteria such as the Shigella have the endotoxin in their outer membrane of the cell wall. The deep plantar artery is the branch of the dorsalis pedis. Next, 80, the fetal part of the placenta is decidua basalis and the chorionic frondosum. Eating raw or the undercooked meat can cause the infection by the tapeworm. 55-year-old man with the painless testicular swelling and the LDH raise. What is your diagnosis? That is the lymphoma. Sarcoma diagnosis by the increased vascularity in adults. Injury to the neck of the femur. Which artery will be damaged at the medial and the lateral circumflex artery? 85, 65-year-old man having the fracture pallor and the weight loss. A golden yellow pigment is in the liver which turn blue on the staining. This is the lipofuscin. Upon autopsy, the patient was having a thrombus. How to know if it occurs after death? That is chicken pox, chicken fat supernatant. Next, 87, the dehydration. Which of the following will be raised AD at the posterior cerebral artery when damage causes homonymous heminopia with the macular sparring? The kid with the sweat chloride test positive developing recurrent chest infection, otitis media, likely due to associated bronchiectasis. Next, 90, the injury to the greater wing of the saphenous inferior orbital figure damages which nerve? That is Charlie zygomatic. The ischemia, infarction, infection all cause cell injury. What is the common thing that will happen due to cell injury by all of these? That is ROS production, reactive oxygen species production in pneumothorax, lung inward and chest wall outward. 6 months of the renal transplant, patient presented with the signs of renal failure. Symptoms are resolved by giving immunosuppressive therapy. What is the likely cause? That is acute cellular rejection. 94, the child having the history of consumption of the fast foods presented with anemia and the raised MCV greater than 104. The most probable cause is the folic acid deficiency. 95, The 50 years old hypertensive patient presented with a severe pain radiating towards the back suddenly collapsed. On autopsy, what could be seen? Medial necrosis. And 6, the low grade follicular lymphoma translocation is which of these? That is 14:18. And 7, the slowest speed of the conduction velocity is present in which of the following? That is AV node. Next, 98, if the temperature of the set point increase, then there will be decrease in the sweating. 99, the mean arterial pressure below 60, what will activate? That is CNS ischemic response. 100, baroreceptors maintain the mean arterial pressure. 101, the patient with the localized circumferential lateral wall infarct, which artery is involved? That is LCX, left circumflex. 102, the patient had the cuffed and the x-ray shows hilar lymphadenopathy. Non-caseating granuloma. Non-caseating, go for sarcoidosis. Pap smear done which shows the dysplasia, but base membrane is intact base membrane. That is with dysplasia. Intact base membrane with dysplasia, that is carcinoma in situ. The best approach to prevent CMV cytomegalovirus infection in the transplant patient is the screening of the donor blood in the cytomegalovirus inactive blood transfusion. A student examining staining which shows the gram positive cocci in the chain. Many attempts made but can't be cultured. What are the techniques can be used to apart from it? That is the enzyme electrophoresis. 106, the benign tumor common in the GIT is of which of the following? That is the adipose. The 5-year-old child presented the rectal prolapse. Organism responsible is Trichura. Next, 108, the strongest layer of the bowel is the submucosa. Transition from the skeletal smooth muscle in the GIT occurs at the mid-esophagus between the stomach, body and the pylorus. What is present? That is antrum which of the following hernia is associated with the herniation through the Hazelback's triangle. That is a directing one hernia. 112, bone marrow biopsy is done at which of the following site in the infants? That is tibia. Next, 113, ferritin at the head of sperm helps in adherence of the sperm head to oval membrane. Beta. 114, the part of the sperm containing the proteolytic enzymes to digest the zona pellucida is the acrosome. The structure from the medial to the lateral in femoral triangle is vein, artery and nerve. Artery layer from inner to the outside is the tunica intima, media and adventitia. Next, 117, the correct sequence of events for the neutrophil migration towards the site of acute is migration, rolling, adhesion, and the transmigration. MRAT or Marat, you can remember it as. Next, in a study, 40% women have received HRT and 20% have not received HRT. Best way to represent such study is the pie chart. Passive immunization is achieved by the IV immunoglobulin. Most common malignancy of the lung ball is the adenocarcinoma. Regarding LCX, true is supply assay note 90%. The cause of the kidney stones in the vitamin A deficiency is the atrophy of the renal mucosa. CRP, transferrin the heptoglobin are the examples of the acute phase reactants in intrinsic damage. Which factor cause activation of the coagulation? That is the factor number 12. Sodium channel inactivation occurs in the absolute refractory period. The both sides, lateral pterygoid and the anterior belly of the digastric contract or pull leads to the opening of the mouth. 127, the excess normal saline infused, this will lead to the increase in the blood volume. Insulin dependent GLUT is GLUT4. Next, 129, the transport of the glucose across cell membrane occurs by the facilitated diffusion. As a resident in the pediatrics, so you are called to see a newborn who has a unilateral cleft lip and unilateral cleft of the primary palate. This condition is most likely the result of Charlie, the failure of fusion of the maxillary prominence with the medial nasal prominence. The small muscle of hands are supplied by the T1. After RTA GFR decrease in the patient came with excessive bleeding. Cause of the decreased GFR would be decreased arterial blood flow. The chloride transport in the loop of the Henle is by the co-transport with the sodium potassium. Regarding bone formation, true is the newly laid bone is called the osteoid. The patient had an MI on ECG, ST elevation in the 2-3 AVF, that is RCA. Next, 24-year-old boy develops jaundice pallor and the breathlessness, having the splenomegaly. Jaundice develop again and again. Likely cause would be the hemolytic anemia and the pre-hepatic jaundice. There is increase in direct bilirubin. Sweat glands in the pilorectal muscles are cholinergic, post-ganglionic, sympathetic. Lady with the CRF. Patient sample taken which was placed in the refrigerator overnight. Next day, normal solution, raised potassium, raised concentration of PO4 and LDH. What is the cause, that is beta option, which is hemolysis of the blood sample. Next, low epinephrine causes vasodilation via B2 anti-sera agglutinates with the A and D, and the plasma has anti-B antibodies. Which blood group it is? That is A positive. Important finding at the angle of the Lewis is opening of physicus when the superior vena cava. 140, the patient with the HB of 15. Oxygen content of the hemoglobin is 20 ml. Alveolar partial oxygen is 40. Venous oxygen is 15. What type of hypoxia is this? That is a hypoxic hypoxia. Regarding the bronchial asthma, the most probable finding would be the FEV into FVC ratio less than 65. Tumor marker of the astrocytes are the GFAP. The patient presents with the pain in the lumbar region, stone at the pelvic ureteric junction, pain arising from which segment? That is L2. The pregnant woman has increased the girth of abdomen, which is example of the adaptation, which is comprehensively defined as the reversible structure and the function change in the response to physiological and pathological stimulus. The person had traumatic instance of the upper limb for 3 months. He develops pain and tenderness and swelling develop in the region. On X-ray, swelling in the is bright. After 1 year, it is resolved. This phenomena is myositis ossificans. Next, metaplasia, or this condition is myositis ossificans. 149, the woman and the man had the history of recurrent pregnancy. The clinical and the genetic history is unremarkable, but all pregnancies end up stillbirth. How will you investigate? That is the karyotyping. The penicillin anaphylaxis reaction characteristic feature is the bronchospasm infection. The kidneys pass up to Zerota fascia. With the fascia intact, it can spread to the inferior to the pelvis. Glutamate aminotransferase and the alanine aminotransferase formation use which vitamin? That is biotin. The woman with the breast cancer subsequently developed the metastasis to the vertebral column. The most direct route of the spread of tumor to the vertebral column would be the venous connections. Next, this question is basically misprinted here. Next, 155, the patient has a respiratory depression due to the involvement of opioids. Act on which receptor? The strong mu receptors agonist. The patient after penetrating abdominal injury on the antibiotics for the 12 weeks therapy and 3-week TPN with ecchymosis. Platelet normal, PT is 14. The cause would be the vitamin K deficiency. The man after RTA got a head injury which is to be stitched 10-inch wound laceration. Which anesthetic agent will best for suturing the wound? That is the 250 ml of the 2% lycanocan. The adrenaline event occur just before opening of the aortic wall is the beginning of the systole. Which one of the following occur? The inflammation, that is exudate. Next, 160, the follicular carcinoma of the thyroid metastasis to which organ? That is the lungs. Patient presented the fever, neck, rigidity, connects and positive. Which investigation should be guided with the CSF analysis? Only indication of use of the radionuclide scan in a patient with the developed and diagnosed typhoid carcinoma would be to see cancer mets in the spread, stab injury at the 6th costocartilage on the right side of the sternum. Will Pierce, which are the following structure? The right atrium. 164, the patient with the hypertension and the labs investigation VMA found in the urine. This is the phaeochromocytoma. Like 165, the posterior branch at the aortic bifurcation is which of the following? The median sacral artery. The mechanism of action of the NSAID is inhibit the arachidonic acid. The maximum water absorption is PCT. The 56-year-old executive officer after eating the burger with the fries gets his liquefied, and after centrifuge his plasma appears milky white. This is due to chylomicrons. Next, 171, the steroid producing tumors. Which organelle will be involved? That is SER. Decreased gastrin secretion is by the secretin. In normal persons, decreased acid secretion causes abnormal protein digestion. 69-year-old woman having the fracture is due to the decreased estrogen. The patient having DVT emboli in the venous circulation will lodge in the pulmonary artery branches. The patient having the thrombus in the vein of the leg emboli in the venous circulation will lodge in the pulmonary artery. Next, 177, which one is not given orally because of the highly first pass effect in activation by the liver? That is adrenaline. Renal plasma flow is measured by the paramonopioric acid. Next, 179, the 6-year-old patient having joint pain, redness, swelling and the fever. Likely cause would be the Staph aureus after myocardial injury. Which biochemical changes will be seen in the hypoxia, anaerobic glycolysis and the phosphorylations? Next, the patient diagnosed with diabetic mellitus was prescribed on oral hypoglycemic agents. Now ESR is 30. What could be the drug responsible? That is the glimepiride. Next, 182, the Alzheimer's disease associated with which of the following disease? That is the Down syndrome. Neural crest cells are separated from which of the following? That is the neural tube. The patient presented with the vascular necrosis of the femoral head artery involved is the median circumflex. The mentally retarded 14-year-old boy has a microcephalic and low ear epicantral folds and protuberance of the tongue. This is the trisomy of the 21. So that's all from this particular paper. Thank you for watching my video. Do subscribe my channel. Until my next video, Allah Hafiz.